Today I continue our series on how mental health and physical health are interrelated. And I'm joined by Dr. Shawn Lee, a clinical psychologist.
Hi Azran, hi everyone.
Awesome. So Shawn is also Naluri's head of science, and he leads our clinical research on human behavior models. And his PhD specializes in pain management, a topic that we're going to explore today. So Shawn, you inflict pain on people.
Only to certain people, Azran.
Oh, just like me?
Yes.
So Shawn, let's start today by talking about how chronic physical pain often coexists together with depression and anxiety, diabetes, and heart diseases.
Now, my answer to this question has two levels. One more generalized, another one more specific. So one thing that all these conditions that you have mentioned have in common is that they are all chronic or long-term in nature. So things like diabetes, anxiety, heart diseases tend to develop certain lifestyles that basically put people at risk of developing chronic pain. And this is mainly due to muscle wastage and also deconditioning. So on a more specific level, each condition that you've mentioned can actually lead to pain via different mechanisms and pathways. So for example, anxiety, depression has been shown to affect the HPA axis, the hypothalamus pituitary adrenal axis, which has been shown to play a role in chronic back and abdominal pain. So poorly managed diabetes can cause nerve damage that can actually cause neuropathic pain. And needless to say, chest pain is often present in angina and basically heart diseases.
So how does pain and psychology relate to each other?
Now, pain is something that we usually experience in our body. So what very few people realize is that pain, in the strictest sense, is actually a psychological experience rather than a physical experience. So to help me demonstrate this point, I would like to invite you to basically do some experiment with me.
Okay.
So use your stronger hand, okay? And then basically try to pinch your weaker hand. So do it as hard as possible, okay? Until you feel the pain.
It's painful.
Okay, good. Now do it again, but do it gentler. Okay?
Okay.
Feel how the sensation in your hand is changing.
Yes.
And then now pinch harder again.
Okay.
Okay, let it go. So now, ask yourself a few questions. So number one, at what point does it become pain? Okay, how do you know that you are feeling pain? Was it related to how forceful you did it? Was it related to how much pressure was being placed on your skin? How do you know that you're experiencing pain?
I think I experienced more pain the second time because I anticipated it.
So you will find it that it's actually not that easy to answer that question. I can assure you that the same amount of force when it's being placed on your skin will actually feel differently when you're in different psychological state. And the underlying point of this experiment is that pain is actually a perception. Pain becomes pain when you perceive it as pain. And perception, fundamentally, is a psychological experience.
So how can a psychologist help someone who's wrestling with pain?
Now, although pain is experienced in the body, it is actually processed entirely in the brain. And basically, everything we feel in our body is actually processed in the brain. This is to say that anything that can change our brain's activity can actually change the way we experience pain. So when a psychologist works with a pain patient, we do a few things, obviously. Number one is that we share techniques and train patients to do techniques that can actually directly or indirectly change the way their brain works and therefore change the way they experience pain. And more importantly, we teach patients to function despite their pain, because pain often leads to certain lifestyles and habits that can actually lead to further dysfunction in the future. And psychology comes in to disrupt the pattern, hopefully to help patients function despite pain.
Okay. So a couple of years ago, I got involved in a pretty nasty car accident. Broke my shoulder, bones all over, and within a few months, the pain kept coming up. So how does someone cope with prolonged pain?
Now, the first step to pain management is definitely proper assessment and basically diagnosis. This is because the management of different types of pain can actually contradict with each other. So for example, acute pain, which is the type of pain that most people are familiar with, is actually a result of injury. And in order to recover from this type of pain, basically we need appropriate rest and to avoid further injury. However, when it comes to prolonged pain, where most probably your injury has actually healed, resting further will actually not help you feel better. Instead, it will actually make your muscle weaker. So the first step, if you have pain, is to talk to a specialist in this area and basically determine the type of pain that you have.
And but soon after that, get back into training, get back to cycling and swimming and running.
Now, for people with pain, a challenge is that when they experience pain, they usually take a longer time for the pain to subside. So for example, a generally healthy person, if we exercise, will probably feel better after 2 days of rest. But if someone already has a chronic pain condition, they may actually take weeks to recover. So the recommendation from pain specialists is generally to not overdo yourself, but also not underdo. So there is a way we basically help our patients to just work out and exercise at the right level.
I can tell you as triathletes, there's no such thing as underdoing.
Okay.
We're always a bit more hardcore. But anyway, thanks for sharing, Shawn. But before we go, can you share one personal fact about yourself outside of work in a professional setting?
Well, I feel that I do not have enough time for video games, but in reality, I know that I probably spend too much time on it. So I'm really waiting for the day I retire so that I can just play games all day long.
What's your favorite game currently?
Currently, I just bought a Switch, so I'm on my Switch all the time, Nintendo Switch.
All right, my son plays that. Awesome. So there you have it, guys. So even psychologists are humans too, with their own addictions, especially video games. But anyway, let's keep it real. And until next time, let's keep it positively personal.